the joints. The study of joints is known as syndesmology. So these are the competencies you should know. Coming to the joints, introduction. Regions of the skeleton where two or more bones meet and articulate, that is the given the name joints or articulation. So all the bones of the body except hyoid bone in the neck are connected to at least one other bone. So they are connected with one another bone. So this is the weakest part of the skeleton, which is supported by a variety of soft tissue structures. The functions of the joints is they hold the skeleton bones together, facilitate the growth, transmit force between bones which helps in movement and weight to be transmitted. The regions articulating in different bones, in case of long bones, these are the ends which are going to articulate. In flat bone, the edges they articulate, and in irregular bone, the various parts of their surfaces they articulate. So the classification of the joint, broadly we classify the joint based on its structure and function. So structural classification is based on type of connective tissue and presence of joint cavity. So in this structural classification, the subcategories are fibrous joint. If the fibrous tissue is present in between the two bones, so the types of fibrous joints are sutures, syndesmosis and gomphosis. Then second category is cartilaginous. If the cartilage tissue is present between the two bones, or you can say in the joint cavity. So there are two types of cartilaginous joint, primary and secondary. Primary is given the name synchondrosis and secondary is given the name symphysis. Third category of the structural classification of the bone is synovial, so which includes a number of categories, that is plain synovial joint, hinge joint, pivot joints, condylar joints, ellipsoid, saddle and ball and socket. So this is the structural classification. Now coming to the functional based on the mobility. So the joints may be immovable, we call them as synarthrosis, and the example is the fibrous joint. Then slightly movable or amphiarthrosis, example is cartilaginous joint, and freely movable or diarthrosis, for example is synovial joint. Coming to the structural classification first. So in subcategory we will discuss the fibrous joints first. So in this fibrous joints, the bones are joined together by fibrous tissue, no joint cavity, no appreciable movement it occurs, considered as synarthrosis. It provides stability and help in protection. So what are the different types of fibrous joint in the body? These are sutures, syndesmosis and gomphosis. Coming to the sutures first. So margins of the bones articulate with one another but are separated by thin layer of fibrous tissue called sutural ligament. So types of sutures are these, that is serrate or limbus, denticulate, squamous, plain or wedge and groove. Now what is serrate suture or limbus suture? It is saw-like edges of articulation seen in sagittal suture. Denticulate suture, margins presents a series of tooth-like structures, you can see here, processes with tips being broader than roots. This is known as lambdoid suture. Coming to the next category, squamous suture. Edges of the bones are united by overlapping. So in this region, between parietal bone and squamous part of the temporal bone, this kind of suture is present. Coming to the plain sutures, so they are seen. So the in case of palatine process of maxilla and horizontal plates of the palatine bone, in this region the plain suture is seen. So in this the borders are plain and united by sutural ligament. Coming to the wedge and groove suture, shindialysis, edge of one bone fit into the groove of another bone. So you can see in this, the rostrum of the sphenoid, it fits in the upper margin of the vomer. So this is wedge and groove suture. Coming to next category of the fibrous joint is syndesmosis. Concerned bones lie at some distance, connected by greater amount of connective tissue, that is, or the opposed bony parts surfaces are united by interosseous ligament, so they permit slight movement. You can see here, so the two bones are lying at some distance, but the connective tissue which is present in between in the form of ligament, they united. So the examples are seen in interosseous tibiofibular ligament. So this is one, inferior tibiofibular joint here, then interosseous radioulnar joint, the joint between adjacent laminae of the vertebrae. So these are the examples of syndesmosis. Gomphosis or dentato-alveolar. So articulation by insertion of the conical process into the socket and is united by the fibrous tissue. The intervening tissue is collagen of periodontium. So example is roots of the teeth in bony sockets anchored by periodontal ligament. So this is the example of gomphosis. Coming to the next category of the structural classification, that is cartilaginous joint. So the opposed bony surfaces are connected by cartilage. So in this the limited movements they occur. So types are primary cartilaginous joint and secondary cartilaginous joint. In primary cartilaginous joint, we call them as synchondroses. So these are immovable and strong joints. The bones are connected by plate of hyaline cartilage. Joints are temporary in nature. So after a certain age, the cartilaginous plates, they are replaced by bone. This is why we call them as synostosis. So conversion of the cartilaginous plate into the bone, that process is known as synostosis. So rarely occur in midline. So these are the examples of the primary cartilaginous joint, that is epiphysis and diaphysis of the growing long bone, spheno-occipital bone, first chondrosternal joint, then costochondral joint. So these are the costochondral joint, then chondrosternal. First chondrosternal joint is the example of primary cartilaginous joint. Coming to the secondary cartilaginous joint, we call it as symphysis or fibrocartilaginous joints. The articular surfaces are covered by thin layer of hyaline cartilage. Then bones are joined by plate of fibrocartilage. Thickness of fibrocartilage is directly related to the range of movement. So little movement is happening at these joints, and these joints are permanent joint. So examples are these, that is symphysis pubis, manubriosternal joint, intervertebral disc. So we can see these are midline joints, basically midline joints of the body. These joints may represent an intermediate state in evolution of synovial joint. Coming to the intervertebral disc, it lies between the vertebral bodies. So in between these, the vertebral bodies, this joint is, or this disc is lying. Each intervertebral disc consists of annulus fibrosus at the periphery, you can see here, and nucleus pulposus in the center. What is annulus fibrosus? It is composed of series of concentric layers and fibers in alternate layers are arranged in crossed manner. So concentric layers of fibers in alternate layers are arranged in crossed like manner. So then nucleus pulposus, it is a gelatinous mass containing abundant water, cartilaginous cells, multinucleated notochordal cells. As the age advances, notochordal cells they disappear and the nucleus is replaced by fibrocartilage. So these are the functions of the intervertebral disc. They act as shock absorber, offers resistance to compression and ensure even distribution of compression forces to upper and lower surfaces of the vertebral body. So they act as a shock absorber. So in this applied aspect of this intervertebral disc, prolapsed disc is the most common. Sometimes a disc is prolapsed posteriorly, resulting in the radiating root pain due to involvement of the spinal nerves. You can see. So this is the prolapsed disc. Posterolateral displacement of this disc is compressing the nerves. And most common cause is, you can say, the clinical pathology which is seen in prolapsed disc is sciatica, compression of the sciatic nerve. Coming to the next category of structural joint is synovial joints. Synovial joints are diarthroses, highly movable joints. So this is the most common type of joint. What are the features? In this, the joint cavity is present. This is first feature of synovial joint, which is filled with fluid called as synovial fluid, which is secreted by the synovial membrane. Now, joint cavity allows free mobility. So these joints are lined by synovial membrane, and that synovial membrane secretes the synovial fluid. So you can see here, this is the synovial joint. It is lined by the synovial membrane. So this synovial membrane is secreting the fluid, which is known as synovial fluid. Now, second feature of the synovial joint is its articular surfaces covered with hyaline cartilage. Articular, you can see here. So articular cartilage is covering these surfaces. This articular cartilage is avascular, non-nervous, lubricated by the synovial fluid. Joint cavity may be divided completely or partially by a disc or menisci. So this is another feature. So the function of this that is articular cartilage aids in the smooth and frictionless joint movement, and it resists the compression forces. The third feature of the synovial joint is that is fibrous capsule is present. So it completely covers and encloses the joint cavity. You can see this is the fibrous capsule, consists of longitudinal and interlacing white connective tissue fiber bundles. It forms the articular capsule, which consists of outer fibrous capsule and inner synovial membrane. So articular capsule consists of two structures, that is outer fibrous capsule and inner synovial membrane. So fibrous capsule, it covers the joint cavity completely. Function is this fibrous capsule, it stabilizes the joint and prevents dislocation, has numerous nerve endings, stimulation of which leads to the contraction of the muscle such that the joint is brought to the position with maximum comfort. So this is the function of the fibrous capsule, stabilizes the joint basically. Fourth feature of the synovial joint is presence of synovial membrane. It lines the entire joint cavity except the articular surfaces, which is covered by this articular cartilage. So it is not covered by the synovial membrane. Rest of the joint cavity is covered by the synovial membrane. Now these articulating bones are united by the ligaments. So articulating bones, they are connected with each other with the help of ligament. Function is it produces the synovial fluid which lubricates the joint cavity. So these are the features of the synovial joint. Now what is the classification of the synovial joint? If we see the number of articulating bones, the synovial joint may be simple, compound or complex. Simple is two articular surfaces are involved, which is seen in interphalangeal joint. If the more than two articular surfaces are involved, for example ankle joint, we call it as compound. If the joint cavity is divided into two distinct compartments, as it is seen in knee joint, we call it as complex joint. So now you can see here, so the articular disc is dividing the joint cavity into two parts, upper and lower compartment. If the more than two bones they are taking part in it, that it is compound, this is complex, and this is a simple synovial joint. Now next is according to the axis of movements and shape of the articular surfaces. It may be uniaxial, biaxial, polyaxial or plane joints. Coming to the uniaxial, they has 1 degree freedom of movement. So example is hinge or gingivimus joints, movement occur in transverse axis, elbow joint, ankle joint, interphalangeal joint. That is, these are the varieties, types, hinge, pivot, condylar joint. Then is second is pivot or trochoid joint, movement occur in vertical axis. If it is happening in transverse axis, these are the examples. If it is happening in the vertical axis, these are the examples. That is atlantoaxial and radioulnar joint. Then if the movement mainly occurring on the transverse axis and partially on the vertical axis, so these are the example, that is knee joint and temporomandibular joint. So this is temporomandibular joint, this is knee joint. Biaxial joints, they have 2 degrees of freedom. Types are ellipsoid or saddle joints. Ellipsoid joints are one articular surface is convex or elliptical, other one is concave and reciprocally curved, so that both articular surfaces they can accommodate each other. So movement take place in transverse and anterior-posterior axis. So these are biaxial joint. Example is wrist joint, metacarpophalangeal joint. So this is metacarpophalangeal joint. Then atlanto-occipital joint. So this is the wrist joint. Biaxial joints types. Next type is saddle joint. Articular surfaces are concave or convex. So this is the example, carpometacarpal joint. Then sternoclavicular joint and calcaneocuboid joint. So these are biaxial joints, and the movements which are happening at the saddle variety of joint is flexion, extension, adduction, abduction, rotation and circumduction. Polyaxial joints are 3 degrees of movements occur, that is in transverse, vertical and anterior-posterior axis. So examples are ball and socket variety of joint. Example is hip joint and shoulder joint. You can see here. Next is plane joints. Articular surfaces are more or less flat, permit the gliding movement. Example is intertarsal and intercarpal joints. So these are the examples of plane variety of joints. So these are the different varieties of the joint, types of synovial joint which we have discussed. Now factors which are limiting the range of the movement of any joint. So shape of articulating bone, tension of the ligaments, tension of antagonist muscles and approximation of soft parts. And what are the factors which are just adding to the stability of the joint? That is bony configuration, bones fitting into each other. Then ligaments, intracarpal, extracarpal, capsular, means the ligaments which are present within the capsule, the ligaments which are present outside the capsule. So they just helps in the stability of the joint. Then muscles, the strength and tone of various muscles, and definitely next is atmospheric pressure. So blood supply of the joints is by epiphyseal vessels, whatever be the vessels that are lying around that particular joint, that is going to supply that joint. And nerve supply is of the joint is again sensory and autonomic, and the fibers are coming to the different nerves which are just running in relation to those joints. What is Hilton's law? The nerves supplying the muscles acting on the joints also give branches to the joint and the skin over the joint. So this is Hilton's law. Functional significance is when the joint is injured or damaged, the nerve supplying it will stimulate the muscles to contract in a way to bring the joint to a position of maximum comfort, thus protecting the joint. The joint pain is referred to as the skin over the joint. So this is the reason. This is the functional significance of Hilton's law, which is stating the nerves which are going to supply the muscles acting on that particular joint also give branches to the joint and the skin over the joint. So that is Hilton's law. Gardner's law is the part of the capsule which is rendered taut by the contraction of the group of muscle is supplied by the nerve which innervate their antagonist muscle. So this is Gardner's law. The applied aspect of the joints is arthritis and direct physical trauma to a joint are the causes of joint damage. So whatever be the joint we will discuss individually, we will discuss the applied of that particular joint with that. Thank you very much.